Welcome to our deep dive into what may be the largest psychological experiment in human history, one that's happening right now, all around us. I'm talking about the global response to the COVID-19 pandemic and its far-reaching psychological impacts. When the COVID-19 pandemic hit in early 2020, it triggered lockdowns and social distancing measures on a scale never before seen. Suddenly, billions of people worldwide found themselves isolated, anxious, and facing radical changes to their daily lives. This created a unique opportunity to study the psychological effects of a truly global crisis in real time. As one researcher put it, we're in the midst of a natural experiment in mental health. The sheer number of people affected and the prolonged nature of the pandemic have given psychologists an unprecedented chance to examine how humans respond to chronic stress, isolation, and uncertainty on a massive scale. In the early months of the pandemic, researchers scrambled to assess its initial psychological impacts. Studies from around the world painted a concerning picture. Rates of anxiety, depression, and PTSD spiked dramatically. Sleep disturbances and insomnia became widespread. Substance abuse increased as people sought ways to cope. Domestic violence rates rose alarmingly in many areas. Perhaps most worryingly, these effects weren't limited to those directly impacted by the virus. The pervasive sense of threat and disruption to normal life affected nearly everyone to some degree. As the pandemic dragged on, researchers began to examine its longer-term psychological fallout. Some key findings emerged. With the lines between work and home blurred, many experienced severe burnout. Healthcare workers were especially hard hit. The shared experience of the pandemic created a form of collective trauma with potential long-lasting effects on society. Surprisingly, many people showed remarkable resilience and even experienced positive psychological growth through the challenges. The pandemic didn't affect everyone equally. Certain groups proved especially vulnerable to negative mental health outcomes. Children and adolescents faced disrupted education and social development. Elderly individuals experienced increased isolation and loneliness. Those with pre-existing mental health conditions often saw their symptoms worsen. Economically disadvantaged populations faced compounded stressors. One of the most fascinating aspects of this global experiment has been the rapid shift to digital interactions. From remote work to telehealth, our reliance on technology exploded overnight. This raised new questions. How does prolonged virtual interaction affect our social bonds and mental well-being? What are the psychological impacts of Zoom fatigue and constant digital connectivity? How effective is teletherapy compared to traditional in-person mental health treatment? Despite the challenges, humans proved remarkably adaptable. Researchers observed a wide range of coping strategies emerge. Increased focus on physical health and exercise, adoption of mindfulness and meditation practices, renewed emphasis on family connections and relationships, creative pursuits and hobbies as outlets for stress. Understanding which coping mechanisms proved most effective could have far-reaching implications for future mental health interventions. The pandemic highlighted the crucial role that information and media play in shaping our psychological responses to crises. Researchers noted the impact of constant exposure to pandemic-related news on anxiety levels, how misinformation and conspiracy theories affected behavior and mental health, and the psychological effects of conflicting public health messages. These findings have important implications for crisis communication and public health strategies in future emergencies. As we emerge from the acute phase of the pandemic, psychologists are working to distill the lessons learned from this massive, unplanned experiment. Some key takeaways include the importance of proactive mental health support during crises, the need for better strategies to combat isolation and loneliness, the potential of technology to deliver mental health interventions at scale, and the critical role of clear, consistent public health communication. It's important to note that while the pandemic provided unprecedented research opportunities, it also raised ethical concerns. Studying populations under extreme stress requires careful consideration of consent and potential harm. Researchers have had to balance the need for knowledge with the ethical imperative to do no harm. The COVID-19 pandemic has been a global tragedy, but it has also given us invaluable insights into human psychology under extreme conditions. As we process the data and experiences from this unplanned experiment, we have the opportunity to emerge better prepared for future crises, and with a deeper understanding of our own resilience and adaptability. The lessons learned from this global psychological experiment will likely shape mental health research and interventions for decades to come. While we hope to never repeat such a large-scale crisis, the knowledge gained may help us build more resilient individuals and societies in the face of future challenges. Thank you for joining me on this exploration of the biggest psychological experiment in history. If you found this video informative, please like and subscribe for more deep dives into psychology and human behavior. Until next time, stay curious and take care of your mental health.